Good evening, and if you've clicked on this video, there's a good chance you may be a taxpayer and you're wondering where your money's going and how the political system can be interfering with the health system within one country. Now, for the purpose of this video, I will be discussing it in relation to the UK. However, there's a good chance that it's going to apply to many of the big Western countries because they all have similar foot plans, etc., that all coincide with a lot of things. And why should you listen to me? So my credentials are that I have worked within the UK health system for over 8 years now. I am a prescribing pharmacist, so that's where my specialities lie. But I've worked across multiple areas, whether that be primary, secondary, and even tertiary care within that sectors, community, industrial. So I've got a good experience and breadth of knowledge across all of these areas. And over the last couple of years anyway, especially with meeting up with different people in different areas of business, it just opened my eyes on the whole system and it just made me question a few things. So I'm not going to name certain organisations, but a lot of people who are looking into this may be able to interpret who that may be. So I've got a few notes here as to what I want to go through and just give me a bit of guidance because there's a lot of things I would actually love to discuss here. Probably too much of it would be controversial, but I'll try and remain as PC as I possibly can without hiding any of the stuff that I think people should know about. So within the UK, one thing I do want to state is that all of the things that I will be discussing are my own opinion, and it's mainly based on anecdotal as opposed to actual factual evidence and stats. But a lot of this, as a lot of people understand and aware, that you will be able to get a lot of insight just from having experience within something. So take from it what you will. So the first point I would like to say is the fact that the health system in the UK is funded by taxpayers' money, essentially. So our taxes go into obviously a central pot. Of that goes towards the health system, and then the health system divides that up into many multiple sections, whether that be medication, then different modes of care, so hospital care, primary care, etc. And then depending on the needs of the population depends on where your money goes. And I will state this now, but I will hopefully try and cover it in multiple points throughout the video, is that there is a vicious loop with politics and the funding budget side of things with healthcare, which is why it's not going in the direction I think it should do. And that's the whole purpose of this video and why I've done it, is that politics, in my opinion, do negatively affect healthcare and it dictates where healthcare is going. And in my opinion, it's not going in the correct way, which should be preventative therapy and empowering people of my age group, younger, where you can then proactively initiate certain treatment algorithms, not necessarily all pharmacotherapy, but then you will then mitigate the risk of disease and complications going forward and improve quality of life. So the fact that the health system is funded is a bit of a pain in the sense that obviously taxpayers like myself who are in certain brackets have to give a large proportion of funds towards these sectors. But the good benefit of the health system in the UK is that it is free at the point of use, which is an asset. And it is, no matter what way you look at it, to have healthcare free at the point of use and need is a phenomenal thing. However, a lot of people state the quality of the care that they get within this country is pretty poor. And I agree to an extent. There's always poor people in terms of quality and experience in all sectors in life. It's just a shame that in healthcare, the cracks show a bit more. And the best analogy would be if you look at a footy team, for example, a goalkeeper's mistakes are more devastating than someone who's a striker. And that's the same thing that happens in healthcare, but I can't deny the fact that there is suboptimal care within this system. But the point I was going to make here is that by making it free for all, you then remove the worth of the system to other people. So for myself, if I was to go and use the system, I've paid more than enough into it. I understand from working with inside it how beneficial it is to do so. But a lot of the people, in my opinion, who use the system are ironically non-contributors, which people might find that controversial, but it's true. From my experience, a lot of the patients that I see on a daily basis are non-taxpayers and they are bleeding the system dry. Now, there's a few things, I don't know whether it's ever been proposed, but whether a small fee, such as £5, even £10 per use, which is not relatable to actually the treatment you're having, but it's a whole concept of you can't just use it. And that applies in a lot of things. If you give out free tickets to an event, people are more likely to sign up and not go to it because they've got no emotional or financial ties to that situation. And I think that should be one of the things that happens in the healthcare system, because a lot of patients that I speak to on a daily basis are merely having that appointment because they can. And then that creates an entitlement. And then this is where it's a double-headed sword, because you've got the political side of things allowing this to happen because it's being funded, but then you've got the misuse of it by the population side. And a lot of them appointments, in my opinion, are not worthy to be had, and it should be going to someone else, ideally who is paying into the system and who needs it, as opposed to just abusing it. And that is the bottom line. It gets abused, which is a sad thing. And we can't rely on the good nature of people, because we know as humans we're inherently susceptible to bias, and a lot of people just aren't good natured in what they do. There's just no good intentions. It's all for the moment, all for their own self gain. So that's the first point. Should we make it where there's a small fee payable, and it doesn't have to be at the point of service? So for example, if you are unconscious and then you need to be assessed for a stroke or whatever it may be, surgery, you wouldn't pay it at that point. You don't need to have a contactless payment scheme on hand there, and if you don't pay it, then you can't be seen. But whether it's a week or two delayed, I think it's something that's definitely worthwhile. And the way you would offset it is that whatever taxes we pay towards the healthcare system, we would ideally mathematically calculate removing that tax to account for a small fee to be added. Whether that would is another question, but I think that's definitely one thing that could be brought in, and it's something I would like to see, because it would stop the abuse. Now, the next thing is, again, both of these, I say the politics affecting it. The politics and the higher up powers in the country are having this effect, but also it's the people who are using it, and the population by the masses are sort of conforming to these things to allow it to snowball and become a lot worse than what it should be. So the next point I was going to make was the threshold for sick pay and receiving benefits has been lower than ever. And I don't think a lot of people would like to touch on this, but definitely hot topics at the moment within healthcare are mental health. Now, do I believe people have mental health issues? Of course. I think the whole category, I think everyone experiences mental health inequalities at some point in life. Whether you would term it to the extent where it's detrimental to your health at that point, don't get me wrong, there's days where I feel low, there's days where I feel anxious. I wouldn't class that as the inability to function. I would class it as the inability to function at my optimum, but that's the thing, I wouldn't class that. But this is where a lot of people take advantage of this, is that mental health is a very subjective area of medicine, in the sense that you can't clinically measure how depressed, anxious, so on and so forth someone is. So, and because of the complications that can happen from mental health, whether that be self-harming, etc., which I'm not going to go through, then it leaves people who are within the health system in a grey area, because if you don't seek treatment and provide it to whoever it is, whether they may not be appropriate for treatment at that time, you always have that fear of a medical legal battle that would come your way, which I feel is completely unwarranted, in the sense that we want a population who want autonomy, free speech, all these things, but then when it comes to healthcare, then we have to hold people's hands, which I don't agree with in any way, shape or form. It wouldn't happen if I go and take a loan out from a bank and I get approved and I go and gamble it and misuse it. It's not the bank's issue, and it shouldn't be our issue in healthcare if that we don't give certain forms of treatment and follow up all the times, that you should be deemed liable for that situation. But the point is that the threshold for receiving sick pay and benefits are lower than ever. So then what's happening is, like I've just said, a lot of healthcare professionals are more likely to be scaremongering into signing a sick note. Mental health being one of the biggest areas, probably the biggest area, I'd say, followed by musculoskeletal problems being second, lower back pain, knee pain. A lot of it, I'd say 90% of the time, is self-inflicted, mainly due to lack of activity, obesity, poor lifestyle interventions. But again, people like myself who pay into the tax, actually it's harder for me because I work within the area, is that I'm paying for these people to have gross negligence towards their health. I don't agree that's fair, because I've had myself, and I know family members where we can't access treatment at certain times, but I've personally treated someone who has abused the system. But do I think that should be hired? Of course. How you're going to do that, again, is another issue. It's very hard. But the reason I brought this point up is that a lot of people who seek sick notes, mental health disorders, whatever it may be, there's a lot of financial gain by doing so. For people who have sick notes, you get paid for being off sick. What an easy life, in my opinion. People who have mental health notes, I can't verify this, but I've seen a lot of things with the budget recently where they've removed the two-child cap per household, meaning that you can basically increase the amount of kids you have. You'll get funded for that through a benefit system. Ridiculous. And then you can just claim, if they have then ADHD, ASD, you name it, they will then get funded even more, which, again, I agree there are people out there who have these disorders, but the fact that so many people claim against it dilutes the actual severity of these conditions, which is a big issue, because the people who genuinely need the help then go under the radar, get missed, and that's where you have a lot of complications with health going forward, both physical and mental. But once you seek all these notes and referrals, etc., all that money goes into this area, which is my issue, is because that money should then be spent really on giving people blood testing who are younger, giving people the advice now to mitigate future chronic diseases, which it baffles me as just looking at it from a business point of view. So the health service in the UK is funded, and the whole idea of this service is to make it free at the point of use, but also to cost save where we can. A large proportion of my job within pharmacy is to, and anyone really within healthcare, is to reduce costs. So whether that be prescribing certain drugs because they have reduced prices on the drug tariff, or not referring and putting through so many blood tests here because it can be this expensive and there's no clinical need at this point in time. It just leads to a substandard level of care, which we would completely recoup the cost back if we were to invest in it now. And that's why it baffles me, because surely it would be in their interest to offset costs for future use. But there's obviously a lot more going on behind the scenes than I'm aware of. But they were the two main points, and I'm just trying to think if there's anything else. But that's where the politics greatly affect healthcare, is that they do not incentivise, same with a lot of things within government at the moment, they don't incentivise people to lead a healthy life. So for example, if I take myself, I don't go on sick pay, I look after myself every day, I do the hard things that people don't want to do, don't really eat ultra processed food, and make sure I go to the gym, stay active, work hard, all these things, make sure I pay all my taxes. And I'm not really incentivized to do that, because if I just say, well, actually I don't feel the best today, or I've got a sore back, can I be signed off sick? I then get paid for doing absolutely nothing. And then all my money that I've been put into the system gets offset onto all these, or the majority, shall I say, because like I said, there are instances that it does apply. But I just thought, there's a lot of things I could say into this video. I think I've got to be careful with what I say, but you've just got to look at it from that point of view. I think we should make care within this country a chargeable service. I don't think it should be fully private, because if you are then discriminating against financial background, which I don't think is true and fair, but I think it reduces the amount that you would abuse the system. And I think we should actually, the whole reason why I can't say what I truly feel is because PC, freedom of speech, it's all a fallacy within the UK. I can't fully say what I want to do or what I think at this moment in time. And this has crept into healthcare where you cannot revoke treatments, you can't go against the patient's wishes, when in actual fact we're the ones with a medical degree, we're the ones who can prescribe, we can refer, treat, but we have to listen to the patient, which to some extent we should have a shared care agreement where we discuss the options together, but it shouldn't be dictated by the patient when it comes to the prescribing of highly abusable drugs and medication and financial rewards. I just think that's completely wrong. But if you've got this far, I appreciate you for watching. If there's anything that you feel is unfair, or I'm going to go down this route of hopefully opening some more truths behind the healthcare system and why it isn't at the preventative area and why we're a long way off, in my opinion. And that's the whole point of these things, is that my passion is preventative health, and the more people that I can make aware of the beauty of investing in your health early on in life, actually recognising what a low quality of life is. It's not just ending up in a hospital bed, having a cancer diagnosis or all them things. It's simple things such as, can you do the things you could do maybe a few years before? And if that's a no, that's a reduction in the quality of life for me. And they're the early warning signs that we should be mitigating and we should be proactively trying to reduce going forward. But like I said, if you've got this far, thanks for watching, and I will see you in the next video.